Hello everyone. Today we'll be discussing about management of snake bite. So initially the most important thing is the first aid control, for which there is a mnemonic. You can remember it as carry no right. I repeat, carry no right. So what does C stands for in that? C is carry the patient. Do not allow the patient to walk. So whenever there is a snake bite, whenever a person gets bitten by a snake, you should no, you should not allow him to walk. What happens is whenever he walks, there is increased blood circulation through it, and there can be a rapid spread of poison via that blood. That's why the patient should never be allowed to walk. He should be only carried. Second is no tourniquet. So that is very important. Many of the time we see that whenever there's a snake bite, people tends to tie just above the bitten side. They generally tie with a cloth or something, so to prevent the spread of poison. But what happens is actually whenever there is a spread of poison, it is through the deep vessels and all, and it cannot be tied too tight. Too tight can lead to a dangerous complications and can cause gangrene or loss of limb as well. So no tourniquet or electrotherapy is advisable, and it doesn't help. Second, third is R is reassure the patient. So whenever a patient is getting bitten by a snake, so they are very much panicked. So always reassure the patient that he is fine, nothing will happen. So that is another thing which is important. Fourth is eye is immobilized in the same way as a fractured limb. So wherever the limb is bitten, so normally what in a fracture thing, what we do, one joint above it and one joint below the fracture set, we immobilize that part. So similar way it has to be done in the case of a poison case also. Next is GH. GH is nothing but get to a hospital immediately. Next is T. T is right. That is T is tell the doctor of any systemic symptoms which you have manifested with. Any symptoms which you have seen, you should tell to a doctor. So again, it is carry no right. T is carry the patient, not allow patient to walk. No is no tourniquet. R reassure the patient. I immobilize the patient. GH is get to hospital immediately. T is tell the doctor. So now we'll be discussing about tourniquet. Tourniquet, as I already said, it is contraindicated. It should not be used. There is risk of ischemia, and there can be also risk of loss of limb. So another risk is that there is increased risk of massive neurotoxic blockade when the tourniquet is released. So what happens is when you have tied a tourniquet just above the site of the bitten site, the poison gets accumulated in that part, and as soon as whenever you suddenly remove that tourniquet or a closed part, there is a sudden rush of poison which enters the blood circulation and reaches our systemic organs, heart as well, which can lead to massive neurotoxic blockade. It can cause neural blockade and can also lead to sudden cardiac arrest. So that's why it should be used very carefully. Next is there is increased risk of hypotension. Venom itself can cause hypotension because it's again by the same mechanism. Sudden load of poison entering the circulation can cause, because most of the poison, sometimes the snakes are neurotoxic. It can cause sudden neural blockade, which can lead to hypotension. And there is also a risk of embolism due to clot formation distal to the tourniquet. So when you have tied some part, there is a blood accumulation at that part which can get clot, and when you suddenly open the circulation, the clots can get dislodged and the patient can present with a stroke or embolic phenomenon. So there are the various types of snakes which we know. What are the clinical features of each type of snake is given in this table. You all know cobra is a neurotoxic snake, means mainly it manifests with a neurological symptom, and local pain is common in all. So you can see local tissue damage is common in almost all of the snakes, whereas neurological symptoms is ptosis. The other thing is more common with the cobra, and also you can see it with the kraits. Vipers usually manifest with the hemostatic abnormalities or hemotoxic abnormalities, which is seen. Like bleeding manifestations are more with the vipers, and also renal complications is more with vipers. And also one more important thing is response to neostigmine. Neostigmine will be useful only in snakes which are neurotoxic. It is not useful for the snakes which are hemotoxic. Whereas ASV is responsible in there is a response to ASV, that is anti-snake venom, in all the types of snakes, except for the humped nose viper. So now one by one we will see what are the clinical features of viper envenomation. So local symptoms, that is swelling and local pain, which is common with all the types of snakes. There also can be a tender enlargement of the local lymph node. And what is the main thing is that there can be a bleeding from different sides. There can be hypotension and muscle pain, which can occur because of rhabdomyolysis as well. So elapid envenomation is basically again is the cobra and the crates, which can mostly manifest with the neurological manifestation. It present as descending paralysis, initially involving cranial nerves, and there can be hypoxia due to inadequate ventilation, because your respiratory muscles get paralyzed sometimes, and that's why you can get to hypoxia. And there is something called as late onset envenoming, that is, patient should be kept under observation for at least of 24 hours. Now, what is 20 minutes whole blood clotting test? This is a very important test in any patient. If you are suspecting there's a bitten snake bite by a viper or a hemotoxic snakes, this test is very important, which gives us an assessment of the coagulation factor, like clotting abnormalities in a patient, that it gives an idea of that. So what we do in that is that you take a few ml of fresh venous blood is taken on a glass vessel. You take a small test tube, you put few ml of blood in that. Plastic bottles, syringes or tubes should be avoided. This shouldn't be used. This is very important. It should be a completely glass vessel, because this plastic syringes actually tends to trigger the clotting. So that's why you should not use that. And once you take the blood in that glass vessel, you should leave it undisturbed. You shouldn't move it for at least of 20 minutes in ambient temperature. So after 20 minutes, what you need to do is you have to gently tilt it, but do not shake. Gently tilt it to a side and see if there is clot has formed or not. If blood is still liquid, that means the patient has incoagulable blood. What does that mean? Is that there is a clotting abnormality in this patient, or maybe there is what it indirectly indicates that there is the snake is a hemotoxic one, and the poison is also in a sufficient amount to cause problem. So then what you need to do is, another thing is, test should be carried out every 30 minutes. You do it every 30 minutes for 3 hours, and then every hourly for next for 6 hours. So this has to be followed. So what are the management of snake bite is, first is painkiller, because there is a local pain and swelling, you should give painkillers. Second thing is handling tourniquets. So many of the time patient comes with a tourniquet, how to handle the tourniquets. And next is the anti-snake venom. We'll be discussing it individually. First is handling tourniquet. So any patient who have come with a tourniquet tied, so first thing is, importantly, you need to remember that you shouldn't remove the tourniquet immediately. Okay, so what is important is that how do you do it? Because we have discussed already that if you remove it suddenly, there can be massive neurotoxic cascade. So that's why there can be patient can have a cardiac arrest or maybe hypotension. That's why you should not remove it immediately. So before removal of the tourniquet, you should test for the presence of pulse distal to the tourniquet. So wherever you have tied the tourniquet, distal to that, you try to check the pulse. Okay, if the tourniquet has occluded the distal pulse, that means then so if it has occluded, that means it is very much tight. So if you release it suddenly, there can be massive neurotoxic cascade. That's why what you need to do is, then you put a blood pressure cuff, can be applied to reduce the pressure slowly. So what you need to do is that, so whenever there is a tourniquet above that, wherever is that, you have to put a blood pressure cuff, the BP apparatus cuff, you do it, you inflate it to a significant amount. Like you can do it maybe 20 to 40 millimeters of mercury, more than the systolic blood pressure. Up to that level, you can inflate it. And then what happens is, and because that also will occlude the blood flow. So then you remove the tourniquet. So once you remove the tourniquet, but since you already have a blood pressure cuff, which is controlling the rapid inflow of the toxins into the circulation, now what you do is, slowly you can make it like slowly you can deflate the cuff, so that the patient is not exposed to a massive load of toxins at once, and it is exposed only very slowly by like step by step, he is exposed to slowly. So that is a very useful thing everybody should remember. Next is anti-snake venom. So after assessing patient, whenever decision is taken for giving ASC, so what is important is that in India, what is available is that polyvalent ASV is only available. Okay, and start ASV whatever dose is available in hand. Do not wait for full dose to be available. So that's very important, because as soon as you start, in a case where it's indicated, more earlier you start, you can prevent more complications. So you should also remember about polyvalent ASV. What is that? It is effective against all the 4 common species. That is, first is Russell's viper, second is common cobra, common crate, and saw-scaled viper. So Russell's viper, common cobra, common crate, and saw-scaled viper. What are the indications of giving ASV? Is that there should be evidence of coagulopathy. You shouldn't give ASV in all the patients, because there are risk of allergic reactions or anaphylaxis reaction with it, which can be dangerous. You should give ASV only if it is indicated. Otherwise, you should not give it. So first thing is evidence of coagulopathy. How do you measure that? Is you do it by a 20 minutes whole blood clotting test, or if there is any active bleeding manifestation. So like patient is presenting with epistaxis, okay, bleeding from nose, blood vomitings, or blood stools, or bleeding from any other site. So then it is a sign of coagulopathy. Second is evidence of neurotoxicity, which can be manifested by ptosis initially, and there can be external ophthalmoplegia. And also there can be a cardiovascular manifestation like hypotension, shock, and arrhythmias. And also, like if there is a severe and persistent vomiting and abdominal pain, because there could be an internal bleeding which may not be manifest outside. So any patient with a severe vomiting and abdominal pain should also be given an anti-snake venom, should be given. Another criteria for giving ASV is that the severe or current local envenoming. So like for mild pain and swelling, you will not administer ASV, but if the swelling is severe, that is the local swelling involving more than half of the bitten limb. In the absence of tourniquet, if there is not more than half of the bitten limb, if there is a swelling, then you should administer ASV. And also if there is a rapid extension of swelling, for example, beyond the waist or ankle, within a few hours of bites, if it is rapid progression of swelling, then also you should consider for ASV. Okay, purely local swelling, even if accompanied by bite mark from an apparently venomous snake, is not grounds for administering ASV. So if there is only local swelling, even though the bite marks look suspicious of a dangerous snakes like cobra or viper, but ASV should not be administered unless and until there are manifestations. Most important another thing is that no test dose is required for anti-snake venom, because these reactions which happens to anaphylaxis reaction which happen are not immunoglobulin E mediated, but it is complement mediated. So giving a test dose will not help you in detecting. So test dose is not required. Okay, there can be also they may also get pre-sensitized to the patient may get pre-sensitized to the ASV, and that's why there can be another massive reaction to that. So that's why test dose is not required in case of ASV. So what is the dosage of ASV? So ASV dosage is normally for a neurotoxic drug or an antihemostatic, it is fixed, that is 10 vials. So each vial contains 10 ml. So total of 100 ml has to be given. So, and again, next important thing is that children or pregnant women, whoever it is, the dose is the same, because we are giving anti-snake venom which is acting against the toxin. So if a snake bites, it injects the same amount of toxin in an adult or a children. So we are giving anti-snake venom against the toxin, so not to the patient, not against the patient. So patient weight is not important. So it's against the toxin. That's why it is fixed dose. That is 10 vials should be given in all, irrespective of weight or sex. It is male and females are given equally. So ASV is targeted neutralizing the venom. Snakes injects the same amount of venom into adults and children. The initial dose we have told, it is 100 ml. So it will neutralize 60 milligrams of Russell's viper venom and cobra venom, 45 milligrams of crate and saw-scaled viper, which will be effective in neutralizing major amount of venom injected. So what is the criteria for repeat anti-snake venom? So once you have administered anti-snake venom, or like how much time you need to wait and when you will administer second dose. So there are 3 criteria. If there is persistence or recurrence of blood incoagulability as measured by 20 minutes whole blood clot test after 6 hours of first dose. So why there is 6 hours? Why there is 6 hours is that because the clotting factor, that is a clotting factor 7, it has a half-life of around 6 hours. So when there is a clotting abnormality by a snake, and if you are given an ASV and it has neutralized the toxin completely, but for the clotting to begin normally, the clotting factors, the main clotting factors, take minimum of 6 hours to form in our body. So that's why you should wait for minimum of 6 hours before we administer in that dose. So after 6 hours also, if there is 20 minutes whole blood clotting test is abnormal, then you should repeat a dose. That repeat dose is the same as that the initial one, that is 10 vials. Other indication is that patients who continue to bleed briskly after 1 to 2 hours of first dose. Like even after 1 to 2 hours, if the patient is bleeding very actively, you should give a second dose. And also after 1 to 2 hours, if the patient is deteriorating neurologically as well, or cardiovascular manifestations are deteriorating, then also you should repeat the second dose. So ASV can be administered in, it should be kept as infusion. All ASV to be administered over 1 hour at a constant speed. And local administration of ASV near the bite site has been proven to be ineffective, painful, and raises the intracompartmental pressure, particularly in the digit, and should not be used. I repeat, local administration of ASV should not be used. So ASV reactions, that is early anaphylactic reaction and late serum sickness. So initially it is seen in like 10 to 180 minutes, and 1 to 12 days is late serum sickness. And again, I am repeating, early anaphylactic is not IgE mediated hypersensitivity reaction, it is complement mediated. So if at all any patient develop ASV reaction, what do you do? First thing you do is you stop ASV infusion. Okay. Second thing is, if there is a severe reaction, give adrenaline 0.5 milligrams, 1:1000 IV. Of ASV reactions we'll discuss. So first is, if there is a reaction to ASV, first thing you need to stop ASV infusion. Stop ASV infusion, give adrenaline 0.5 milligrams, 1:1000 IV. So if there symptoms is no improvement, there is no improvement, you should repeat adrenaline after 10 to 15 minutes. So once patient gets better, you should restart ASV, but this time you will start it more slowly, over 15 minutes under observation. If tolerated, then full doses to be given. So in neurotoxic envenomation, another thing you can give is neostigmine. It is of no role in hemotoxic, but neostigmine can be used in neurotoxic envenomation. Dose is 0.04 milligrams per kg IV. It should be given along with atropine to combat the anti-muscarinic effects. To combat the muscarinic effects of neostigmine, you give an atropine. And what are these are the following measures are useful objective measures to affect effectivity of a neurotoxin. So what you do is you make to count single breath count. It is also an assessment of the neurological system, like respiratory muscles exercise. To count, you ask the patient to like take to expire, take a deep breath, and then start counting from 1 to whatever he can count. So normally what it is considered is that if anybody is able to calculate up to 30 to 40, his respiratory system is normal. Next is uncovered area of iris measured in millimeters. So look for ptosis for that. Other thing is inter-incisor distance and length of time upward gaze can be maintained. So this is also called a ceiling test. You ask the patient to sit and ask them to look at the ceiling with the head being in straight position. So amount of time he can maintain that is also important. Next is FEV1 or FVC. Okay. Next is the recovery phase. Spontaneous systemic bleeding, such as gum bleeding, usually stops within 15 to 30 minutes. Blood coagulability is usually restored in 6 hours. Post-synaptic neurotoxic envenoming, such as cobra, may begin to improve as early as 30 minutes after antivenom, but can take several hours. The thing is, the presynaptic neurotoxic envenoming, such as the crate, usually takes a considerable time to improve, reflecting the need for the body to generate new acetylcholine emitters. Okay. So postsynaptics, the cobra acts at the postsynaptic levels. Presynaptic rate acts at presynaptic levels, and acetylcholine has to be generated, and thus it can take time to recover. Active hemolysis and rhabdomyolysis may cease within few hours, and the urine returns to its normal color. In patients who are in shock, blood pressure may increase after 30 minutes. Thank you very much.